Welcome to my channel. In this video, I will discuss Apgar score. So, let's discuss what is Apgar score. It is a test that is given to newborns soon after birth. This test checks a baby's heart rate, muscle tone and other signs. And why this test is done? To see if extra medical care or emergency care is needed. Why this test is done? To see if extra medical care or emergency care is needed. This test is usually given twice, once at a 1 minute after birth and again at 5 minutes after birth. So it is done soon after birth to see if extra medical care or emergency care is required. Given twice, once at 1 minute after birth and again at 5 minutes after birth. Here you can see different grades of Apgar score. You should remember that if Apgar score is 0 to 3, then emergency management is required, and if it is 7 plus, then the baby is normal. Here Apgar stands for appearance. Blue or pale appearance, then 0 score. If body is pink and extremities are blue, then 1 score, and if completely pink, then 2 scores. Then we come to pulse or heart rate. Pulse is when absent, it means heart rate is absent, therefore score is 0, and if it is below 100, then score is 1, and if it is over 100, then score is 2. G stands for grimace or response to stimulation. If there is no response, then obviously 0. If facial grimace, then 1, and if cough or sneeze, then score is 2. A stands for activity or muscle tone. If there is limp activity, then 0. If there is some flexion of extremities, then score is 1. And if there is active motion of the baby, then score is 2. Then we observe respiratory effort. If respiration is absent, then score is 0. If it is slow or irregular, then score is 1. And if there is good or crying baby, then score is 2. So you can see this is Apgar score that is used to assess the different systems of the body to see if extra medical care or emergency care is required. Apgar score is very crucial in some cases, for example, neonatal asphyxia. So this is all about Apgar score. A stands for appearance, P stands for pulse, G for grimace, A for activity or muscle tone, and R for respiratory effort.